So here we go. So Dr. Hsu, I will turn it over to you and give us a quick intro about you and then kind of what you're seeing in the world. And also, Dr. Hsu, you did send resources, which we will make sure we get out to folks because I don't think folks have seen that. So thank you.
Wonderful. So one more thing before we get fully rocking and rolling here. Could you, whoever has control, give me share screen rights as well? I'm going to share a bunch of resources during the course of the next 20 minutes.
Thank you.
Okay. And my name is Kathy Hsu. I am the medical director for the Division of STD Prevention and HIV/AIDS Surveillance. But by way of background and training, I am a pediatrician and a pediatric infectious disease specialist. I still do urgent care one afternoon a week at Boston Medical Center in the heart of downtown Boston. And I'm also on service there 4 weeks out of every year. I have to say that since the pandemic and getting to know so many of you on the front lines, I spoke to over 3,000 of you during the course of the several years that we spent together very intensively managing infection control in childcare settings. Since that time, much of which is sometimes a blur, I often remember the stories many of you shared with me, and they certainly are a part of my life experience forever and anon. But fortunately, my primary attention in my job life has returned to sexually transmitted diseases, which many of you are not affected by at all in the childcare settings, of course. So that's a good thing. Things are really heating up in my own public health arena, and I have not been asked to step forward to help all of you, which is probably a really good sign. However, Amy, do you want to frame what was the trigger for the request for me to step on this call again?
Sure. I think it was around the respiratory viruses and just in general, people seeing an uptick in not necessarily COVID, but other, flus, pink eye we heard about. So just, and kind of back to that circle of, people who are working with children every day, having the best information so that they can work with families and just create these healthy environments.
Mm-hmm. So many of you on this call are even more senior than I am in terms of my 20 plus years of experience working with parents and kids of all ages. Those of you who have worked with parents and kids of all ages for many years recognize that, in fact, what we're living through, while in some ways is unprecedented, in some ways is very precedented, if I might add. The bottom line is that when you're little, you come into the world with some amount of armor given to you by gestation and immunology and the gift from the maternal environment that you're gestating in, so to speak. You get a whole bunch of antibodies. Unless you are an unusual baby, like born a little preterm, or other issues kick in. Because some of you may even know this, you don't actually get antibodies from the maternal environment until about the early 30th week of gestation. And then it sort of ramps up from there until you're considered term and you get born. Once you're born, you get exposed to an incredible world out there. I mean, they're just antigens left and right. And some of those antigens are novel and they cause illness. But thank goodness, that's why we have immune systems. Unless, again, you are an unusual host, okay? Of course, there are some children, premature, some children who are maybe not as healthy, but we have yet to know that because they haven't been exposed yet. And their pediatricians will be winding up diagnosing them with a 1 in a million cause of immunodeficiency, okay? We are not talking about those children today. For the sake of discussion today, we're going to talk about the 80 to 90% of children who come into the world and thereby develop and train their immune system against a host of pathogens. And a lot of that immune system training happens during your toddler ages, which many of you have borne witness to time and time again. You have witnessed the surge as kids come back together, they share their germs. This is in fact probably a very good thing, or it's neither good nor bad, right? It's simply that the human immune system is trained on exposure, okay? So I know that I've told you the story. Sometimes I really enjoyed being on the front lines with all of you because I felt like I owed it to the childcare that gave me so many years of peace of mind. Zach is now 14, but I've had the joy of watching him grow from the very little years when every single cold that he brought home from his childcare, unbeknownst to us, was given to us as his gift. And then we retrained our immune systems as parents. And he was really rocking it through his early elementary school years. My goodness, he never felt ill. He was never out. And that's some of the benefit of that, being with a cohort of individuals. Now, what happens when you expose everybody simultaneously to one dominant pathogen, which then causes society to close down? And then people get back together. You can imagine the ebb and flow, pathogen, host, infectious diseases, how we deal with them. And what we're going to see this fall and winter is somewhat of a resurgence. We will retrain our immune systems. The vast majority of us know germs. We know germs on an intimate level, but many of you in childcare know these germs. You know RSV, you know flu, you know paraflu, you know adenovirus, you know Coxsackie virus, you know, I think I missed a couple of them. Coronavirus, also known as sometimes SARS-CoV-2. All the variant forms, you're intimately familiar with them. You know how to combat them, but do we want to thoroughly combat them is a separate question. So instead, I'll just bring you back to your roots. You know kids, you know development, you know germs, you know how to wash hands, you know how to brush teeth, you know how to prevent them as best as possible. But don't prevent them 100% because you need the immune systems to train and you need them to fight because that's what they're designed and developed for. There are now many, many hypotheses about the fact that if you don't have that training and exposure period, those kids are a little bit more risk later on in life for development of autoimmune processes. It's almost like the immune system must have work in front of it to do, good work, for it not to do overreactive work. Asthma, eczema, atopy, food allergies, the balance, the flip side. These are biological systems. Okay, that set the stage. Now let me remind you, there's a whole host of kids and moms who during those in utero time periods maybe didn't have as much exposures to the occasional colds. People got very protective. They knew how to wear masks. We don't know exactly what will happen with this generation, nor do we want to carefully control everything. We can't. It's like predicting the weather, right? We can't. So instead, we train ourselves to be resilient. And that includes yourselves, resilient to the stressors of the environment of this day and age, as best we can. Okay, so how about we launch into a couple of resources for you? So let me share screen. I have hand selected a few things, and I'm going to start actually, and it was funny, Amy mentioned this, that you, Titus, I think actually mentioned this. I am highlighting here a Spanish language version of a letter that just went out from the Mass chapter of the American Academy of Pediatrics and the Massachusetts Department of Public Health, written by Dr. Esteban Garcia, who some of you may know as a pediatrician who was working out west until he became our medical director for the Massachusetts Department of Public Health. and Dr. Mary Beth Miato, who some of you knew as a pediatrician who was practicing in the mid portion of the state. But I thought I'd highlight the Spanish language version because I just noticed it came out. But let me see if I can show you where the root document is. It's publicly available. Mass chapter of the AAP, Department of Public Health, outlines steps to prevent illness and stay healthy this season. While I do know a small amount of Spanish, I will now default to my native language, which is English, and show you the English language version. And this is just a reminder of all of the things that we are going to do to try to protect the kids from too much circulating infection. Just the right amount would be good. And yes, you will see them blow through your childcares. Yes, you will see that the viral illnesses may be identified because the newer generation molecular diagnostics actually tell pediatrician, aha, that was RSV that your kid has. And some of the parents are being told specific pathogen names rather than the hand-waving pediatricians used to have to do, which was, you have a viral illness. We think it will transpire over the next 2 to 4 days, get worse before it gets better. You'll be left with a lingering cough, who knows how long. Now they can label it. They can call it RSV, they can call it adeno. But it turns out the infection control precautions are exactly the same, and none of them are going to be as bad or highly transmissible. I should not say bad, judgmental term, just not quite as highly transmissible probability-wise as coronavirus, specifically SARS, specifically the pandemic cause, COVID. Instead, when you armor up and you do the best you can with washing your hands, yes, sometimes you will see RSV bloom across your childcare, and you'll finally have a label to the viral illness that's happening in every kid as they succumb to colds. Please remind your parents that we now have a higher threshold. Really, if somebody is very, certainly no kid with a fever should ever come in to your childcare environment. Avoid social gatherings. And when you're most symptomatic is oftentimes for most respiratory viruses when you are most transmissible. So keeping your kid home during those times, having a threshold that's sort of the normal threshold for your childcare is a good thing, because the vast majority will blow through these like cold after cold after cold. Remember, what was normal before the pandemic was 4 to 5 colds. There were some kids, you remember these kids, who had the perpetual runny nose. Who knows if it was the cold air or whether it was cold after cold after cold. And the kids are incredibly resilient to it. It's the parents that wind up coming in dragging that are not doing quite so well. I shouldn't laugh. I still remember those years myself. They were not very pleasant as we were retraining our immune systems. So use these vaccinations as best we can, hand hygiene, cleaning high touch surfaces, and keeping the kids home for the very ill ones, the ones with fever, the standard precautions. Okay, that's A number 1. Make sure that this gets out there. Google mass chapter of the AAP. It's the first hit right now on MCAAP News. They were so delighted to partner with us in the Department of Public Health. Many of us were in on the crafting of that letter and that message. Okay, that's number 1. Number 2, the AAP continues to be our friend. It may be my professional home at times, right? The American Academy of Pediatrics. And sometimes I fuss at them. They're very expensive to join, and I wish more of their resources were publicly available. I'll show you one that's not publicly available in a moment that is very useful. But right now, as their lead topic on healthychildren.org, which is powered by pediatricians, trusted by parents, marketing aside, RSV, when it's more than just a cold, useful information. Almost all babies get RSV at least once before they are 2. Some get very sick. Some. Who's the some? It's the preemies. It's the one with autoimmune systems, potentially. And you can't always tell. But pediatricians for the premature infants will be administering some protective antibodies that are given specifically to preemies. That therapy, palivizumab, is a little bit expensive for everyone, and not everyone needs it because they basically blow through RSV as a very sticky cold. Okay. So some useful information here. a reminder, still has stood me in good stead throughout the pandemic. I will remind you that an excellent resource from the media perspective is the way NPR covers stories in the health realm. So this is just I opened up, oops, am I still sharing? Can you see this?
We can, yeah, it's like the Google.
Oh, good.
Yeah,
I'm just windowing from each one. Good.
I know, you're like a magical screen share. That doesn't usually happen.
Oh, I pulled them up all in advance. I have now gone to Google, but then under NPR, I'm entering a term that some of you have been hearing sensationalized, but it's a fun term, triple-demic. Okay, so let me poke the button and have Google do its magic. Is it triple-demic season? A perfect storm of COVID, flu, and we're left hanging. So let's poke the button and see if our eyeballs can tell us. Let's see, does this look good to me as a resource? October 26, 2022, pretty recent. Celeste Headley, Here and Now. So I filter this piece of information and I think here and now, gee, they like to pit one person against another sometimes and make it a little bit more sensational. But Dr. Jeannie Marazzo is one of my mentors. As it turns out, I would not be who I am today in the STE field if it weren't for Jeannie Marazzo, who is one of the few women chiefs of infectious diseases in the United States of America, has stood us in good stead throughout the pandemic on many, many news agencies. I know, I don't really follow her, but I know her personally, so I know her information will be good. And she was interviewed on Here and Now as the director of the Division of Infectious Diseases at UAB. Okay, wonderful. It aired. It's likely to be a good source of information with good sound bites. All right, what else is Google/NPR telling us about? RSV, what to know about the latest surge and treatments. Oh dear, an electron microscopy photograph of the pathogen itself, probably glomming onto epithelial cells is my guess. Quite gross if you think about it on one level, or very intriguing on another scientific level. So here we are. It's mostly a mild illness with cold-like symptoms in adults. It can cause pneumonia, though, in some hosts. Why might it be particularly bad? Who are they quoting? This is why I'm vetting it with you. It's Dr. Vandana Madhavan. Close colleague of mine. Believe me, all of it is in infectious diseases. It's not that big a world. Okay, so Vandana is over at Massachusetts General Hospital, and she's in Boston. So this is fantastic. She's got great experience. She's likely to give good information. And I'm like, sigh of relief. Another colleague of mine doing great work with the media, trying to get the word out. What precautions can you take? Vandana is speaking to she's being quoted here. Is there an RSV vaccine? Not yet, sorry, soon. ACIP is deliberating on it, maybe someday, not this year. When to seek emergency care? Watch your kid, watch the respiratory pattern, all the things you always would have told the parents, okay? It's just that now we have molecular diagnostics and we can actually tell the parent which virus is causing the cold blowing through the childcare. Last resource for many of you. Many of you actually heard me discuss this. This you will not have public access to, okay? You have to buy it to the tune of $50. This is where I get a little angry at the AAP. Not freely available, but I suppose they have to make their money somehow. Let's not get into that. They have something called Managing Infectious Diseases in Childcare and Schools, which, thank you, Lila Coverstone, my wonderful public health nurse, was the one to introduce me to. I did not even know about it until I was working on the front lines with many of you throughout the pandemic. Wonderful resource, published in 2019, okay, so predates the pandemic, but here's what I want to show you. In my bought copy, I have both the actual purple thing, hold on. So right here, and quick access, but I'm going to show you online why it's so useful. Here's the table of contents. Reduce the risk of infection, overview of managing, health of teachers and caregivers and other staff members. This is the reference that you ask the healthcare consultant if you are so lucky as to have one, to have in their office for you. Or those of you who are directors and really want to know this kind of stuff yourself, share a copy with them. One of the things I find the most useful is this. One section, sample letters, forms, and relevant resources, things I don't usually use, but quick reference sheets. And wouldn't you know it, they do it by lay terminology: Fifth's disease, diaper rash, diarrhea, generic, who knows which pathogen is causing it, but they also have specific pathogens like RSV. Yay. Okay, so let's take a quick peek at the resource RSV specifically. Let me see if I can drive to it very quickly. So I had opened this up in my account. This is not what you would all see. You would instead see advertising telling you to buy this thing. Sorry. Let me just show you the quick reference sheets, which some of you have had the occasion to be gifted with 1 or 2 pages from me. Quick reference sheets. Let me see if I can just search Control F, RSV. How about RSV? RSV comes up a few times, but here's the quick reference sheet on RSV. What is it? What are the signs and symptoms? Incubation and contagious periods. How is it spread? How do you control it? What are the roles of child and caregiver? Do you exclude unless child exhibits rapid or labored breathing, high fever, etc., or other exclusion criteria? Readmit when the following criteria have been met. And cons. The AAP version of what you should do. I'll stop there. And instead ask, any one of you who've had a pathogen blow through lately, give me a name of one. Let's test out this system and see if we can find it quickly. Just throw out a name in the chat. Somebody feed me another disease.
Pink eye.
Pink eye. Oh, excellent. Let's Google, not Google, but you can see what I'm doing, right? I'm typing it as a Control F term. Okay. So pink eye itself did not come up in this document, in this subsection, except maybe pink. Oh dear, sorry, apologies for the picture, but diaper dermatitis, right? Let's try conjunctivitis. There we go. Mosquito-borne diseases, oh dear. Conjunctivitis comes up a number of times in this document. Oh, pink eye was one word. I'm sorry, that's why I couldn't find it earlier. What is conjunctivitis? This is a very literal search engine, right? So all I'm doing is Control F on this document, this E document, to find pink eye. What is conjunctivitis? What are the signs and symptoms? What are the incubation and contagious periods? I find this, by the way, as an infectious disease specialist, a little too generic because it turns out about 3 to 5 respiratory viruses can cause pink eye. We just don't have the molecular diagnostics to tell you which one, and probably each one has a slight variation on when it's most infectious. Like, is the adenovirus pink eye the same as the, and some of them aren't viral, right? There's some kids who benefit from antibacterials, like the erythromycin ointment to treat a strep-ish, staph-ish subbacterial infection. Anyway, this gives you pink eye information. Great, that was a great one to search. Good test. All right.
Hsu, can you just, what's the name of this book so I make sure we can put it in chat?
Sure. Let me go back to the Shining the Light, Managing Infectious Diseases in Childcare and Schools. I'm a little torn. There's no better reference. I'm sorry, it's not free. I'm sorry.
Okay.
Okay.
I think that's, yes, but I think it's helpful. So, and it's AAP, okay.
It's AAP that puts it out. So I know it's trusted information. So the other thing about it, even though it predates the pandemic and it won't have a subsection on COVID, is that it interdigitates with all the stuff that I, as a pediatrician, am supposed to be using as the guidelines for my practice. So it's harmonized with what we pediatricians call the Red Book. The Red Book is on my bookshelf somewhere here. I don't know where I disappeared it. Oh, somebody borrowed it actually the other day. They haven't returned it. Uh-oh. So the Red Book is what pediatricians use to guide families, okay? about all manner of diseases, let alone the ones in childcare. And it's harmonized with the other AAP products. All right.
As we look at the chat, I mean, I think the first piece is when you talked about kind of the generation of children that have been masked and this connection between building up your immune systems and kind of what we're seeing now was so helpful. There's also a question that just got sent to me, and there's a lot of questions in this, and I know we're up against time, but I would love for you to kind of share some thoughts. How do we deal with staff who are immunocompromised or live with someone who is? And then can you talk a little bit about masking and kind of what the best advice is now? And then if staff want their immune system bolstered, should they not wear a mask? And then are children who are vaccinated and under 5 dying from COVID? Those are a lot of heavy questions.
Oh boy. Okay. So one at a time. First, if you mask, again, remember a lot of times through the pandemic, we talked about mathematics and probability. It is very likely that it will cut your probability somewhat of acquiring anything that's somewhat transmitted through the air. But you have to be thorough about masking. We've all learned that when you don and doff the mask numerous times and you doff it while chewing and aerating and talking, certainly for COVID, it was transmissible enough in those short periods of time that it succeeded in getting transmitted. So masks will always be better than nothing, but are not quite as good. Nothing is 100% in any biological system. And it depends on the virus. So if you were to ask me how effective is masking against RSV versus its effectiveness against COVID, I would tell you dollars to donuts, my best guess, without as good studies having been done on RSV as they were on COVID, which affected pretty much everyone, because it was a novel virus. So there are a lot of studies and we know a lot about its transmission dynamics. RSV is a little bit more stable in the environment. So definitely environmental cleaning will be helpful. But these are generic things. These are things you should be doing every night anyway. These are good things to be done. All right. So surfaces, surface survival. Yeah, just think a little bit less about total air transmission, larger droplets, but some respiratory transmission through a sneeze. If I were to rate adenovirus or other Coxsackie viruses, they're somewhere probably in between. Actually, I'm not sure, because you know what? We learned from COVID that we never studied these viruses as accurately because we never gave them names individually. We only knew them as a category of viral illnesses that cause colds. There was a question buried in there about those people who are immunocompromised. It's a very special question.
Yeah.
It's difficult to provide you very nuanced guidance. Individuals who are immunocompromised have to make choices together with the people around them, the people who love them, the people who take care of them, about how to have them most protected, yet not totally protected so they're in a bubble, right? So with no social interaction, which won't be good for them either, as we all know. So it's a balance. The call, the line where things are drawn are not dissimilar to the things that are happening in my family right now as we think about hosting 12 people for Thanksgiving this year, one of whom is undergoing cancer chemotherapy, one of whom is an infant. So where are we going to draw the line? We definitely draw it at, we don't want to be a nexus for COVID transmission, so we're all COVID testing beforehand. To the best of our ability, knowing that rapid antigen tests are no longer perfect at detecting every single variant potentially. And we're making choices. And the people who are making the choices with us walk in eyes wide open. So have clear discussions with the families you take care of about what you're going to do, share the decision-making with them, and say not everybody can be protected against everything, where do we want to draw the precautions?
Great.
That wasn't, hopefully that was clear.
It was, I think, and we've heard you say this so many times, that to rely on experts, that it's so hard to answer some of these personal questions because they are so nuanced.
Because the expert only knows the expert knowledge. The
Right.
expert knowledge is not tailored to your home, your house,
situation.
your families that you support, their cultures. Okay, that's actually an incredible layer that when I work one-on-one with patients and families, I love figuring out, like, if I could give them all my medical knowledge, subtract all my medical worry, but combine it with their feelings about disease. Maybe they're the family that wants their kid to get every single respiratory virus so they make it through elementary school sailing through.
Right.
We got to talk to them. These are great conversations. I love talking about infectious diseases. You know that.
We love that you do.
Yep.
It's 10:06, and I know folks, we have
I have no stop on my schedule today for this.
Great.
So we can keep the recording going. If people need to drop off, they can listen to the recording starting at the time date stamp of 30 minutes in. Okay.
Great. So
have no
let's
fear
say
of missing out.
Let's say we can go to 10:15. Can you talk a little bit about how folks should approach talking with families? Because if families are panicking about certain things, and we know there's a range of feelings and like you said, what people want and need, but just any kind of in your experience, how folks can help parents.
That's a great question. Well, the first thing is, I think you need to understand why in 2022 they are so much more anxious than perhaps arguably parents were 5, 7, 10 years ago. What's driving this? And there are a couple of things. One, on an immediate level, many of these parents do not have recent experiences and have forgotten that it was actually normal to have 4 to 5 colds a year. What is normal, right? Many people don't even know. So that's on a micro level. On a meta level, what society is becoming more and more aware of is how social media and media do drive anxiety, okay? And I think we need to be cognizant of that. This is not a judgment. This is not bad or good. It just is in 2022. People have access to tons of information, whether for good or for bad or for misinformation. So sometimes in your most anxious parents, take them aside, say, let me just talk to you separately. Let's set up a time to talk, and then you can get to know them and ask them what their sources of information are. And if they're willing to switch it up a little bit to things that do not drive them into excessive worry, like the NPR resources that I pointed out to you, ask them to compare the NPR coverage compared to CNN, Fox, MSNBC, something else on the web, okay? Ask them to take a step back with you, and you have only to shine a light on it. It will become immediately apparent who is driving the sensationalism, because they want your eyeball time. They make the money off of your eyeball time, okay? They know that if they drive you slightly crazy, you're just gonna read crazier and crazier things. So you're gonna cling to them. Do we want that? No, we want correct information, just-in-time information, accurate information, not sensationalized health news. I always told everybody, I don't go to health information websites that give me sensations. I watch crazy movies like Matrix Resurrections. I finally got around to starting to watch that yesterday or the weekend with my son and husband. Right. He's a preteen. I mean, he's a teenager. It's a lot of fun. Okay. Hopefully that answered the question.
Yeah, I think that's really helpful. I think as always, kind of like you being the lifeline and like calming force for us, so that we can then be interfacing
calm with everybody else.
We'll bring
because you're the experienced ones.
Can you also, so we've talked with Michael Yogman and Ben Siegel about the role of the health consultant. And I think that's an area that they are very interested in bolstering for early education and care programs. If nothing else, we learned that during the pandemic to have accurate, thoughtful, accessible information was key.
Yeah.
The resources were great, and we will certainly send those. Can you talk a little bit about, like, in communities or public health, like how do people find things and people who can support them besides joining the 9:30 call with you?
Okay. Great question, because I know many of you don't have resources like the larger child cares do. Remember, much of the time I spoke to family child cares who don't have a ton of resources to put a healthcare consultant on their payroll. I think there are different ways that people have approached this. So many times in the kids and families that you take care of, you will notice that there's a nurse or a physician who's a parent. And sometimes those people become invaluable resources later. Do they all have the same level of infectious disease knowledge? No, right? Because not all of them did 3 years of infectious diseases on top of 3 years of pediatric training, on top of 3 years of family medicine training, on top of med peds. Okay, it's just different, right? So suss out your resources. While local is good and the parents know your childcare better, that's not always the best resource. On the other hand, better is not the enemy of best. You know, you kind of have to pick and choose. The second thing is to think about the pediatricians in your community. Many of you have gotten to know them, unfortunately, quite well throughout the pandemic. The practices that wrote good notes, that you had a good relationship with, that understood where childcare was coming from and what they needed. Those practices with those nurses and those physicians and those advanced practice nurses are your friends. Make friends with them. They're your community. Those are your resources. How do you get them? Nothing in life should be free. In fact, the most valuable people should come at some perhaps expense to their time. Not me. I work for the state, and therefore I work for all of you. But maybe thinking about some investment of resources, or if you don't have that investment of resources, buy this one book, $50, written in lay terminology, useful.
It's such a good resource. And I think we saw in chat, I know Danette bought the book. I know people were really helped people.
Oh, people found it helpful, not just me.
That's right.
Good.
So finally, is it worth masking under 5 because they're not good at it? We have been requiring KN95 masks in children over 2, but it seems like it might be futile and would be so magical to toss them off. One parent has sent this article about plastic particles from KN95 may hurt us in the future.
Anything is possible. I suppose I have not seen that particular article. Listen, we've learned a lot about masking throughout the pandemic. The masking is most effective when you do it 100% of the time perfectly, which is never the way children did it. Does it reduce the probability when you wear it for some proportion of the time? Yes, probably. For some trade-off in the future that we have yet to know about, depending on the manufacturer, their plant, other objects, other contact, goodness knows some of them may have, I don't know what else they're made of. Yes, maybe, don't know. Sensationalized information, not evidence-based yet. I do not worry about a future that I cannot control. So instead, I ask a good healthcare consultant to do some research with me on what are the best masks, how to do this. If we choose this, let's choose it eyes wide open together with the parents in our collectives. I think the general trend has been, if individuals would like to mask, we in Massachusetts have been very open to that and non-judgmental. If they would like to send their children to protect them for that partial protection, fine, it's fine. They can choose. We can choose with them. It's okay. It's okay.
Dr. Hsu with infectious disease advice and life advice said, I cannot worry about a future that I cannot control. I think, you know, one thing that we know to be true and we saw day after day and continue to see is this responsibility that people feel with children in their care to make sure they're making good decisions and that they're using the best information that they can have, and just that reassurance that people are doing the best that they can, you know, we are seeing the impact. I think you are right. In Massachusetts, we do live in a different context. You know, I'm looking, as I said, to be with these folks from all 50 states. We know so many ways that people have been dealing with this.
Yep. One more thing for this recording, Amy.
Yes.
So I mentioned Dr. Esteban Garcia is now fortunately our Chief Medical Officer of the entire, I think it's the Public Health Department. And he's a pediatrician, so he's very rooted in childcare, child development, etc. So he'll be a wonderful resource moving forward through the rest of his tenure in that position. I will mention that while I can occasionally come back, I probably should really continue to focus on STDs. So use the existing resources, develop these attachments, and I'm generally around, but mostly focused on STDs now. So thank you. And goodness, I'm looking at this list of people. We can stop the recording now and we can now just do social time a little bit, if you don't mind.